In this video, we're going to demonstrate heavier pressures to the upper limb, incorporating the use of knuckles, forearm and trigger point technique. Okay, so as with all of our heavier pressures, we would have warmed up the area first with our effleurage and our petrissage techniques. So in this instance, I'm using lotion or the lotion from Physique, but you could be using your oil or your wax instead as an alternative medium. Okay, so we want to make sure that the medium is nice and warmed up before we're placing it onto the client. And with our effleurage technique, we're taking hold of the wrist. We want the massage lotion or the medium to come to both sides of the arm here. So as we're effleuraging, we're providing that lift to the limb. And the way that we provide the lift is by having a nice grip on the wrist area, and we're sort of like lifting the arm forward towards you and then up. So after you've done your effleurage and your petrissage techniques, and your petrissage to include your kneading, ringing and rolling, what we would do then is start to apply those heavier pressures. Now, especially if your client is suffering from medial or lateral epicondylitis, you might find they've got a lot of tension in this wrist flexor and wrist extensor area. So with our knuckles, again, we can either have the thumb pointing out or lightly tucked in, and it's a loose knuckle pressure here. So sometimes people like to have their fingers flat and pointing out to the side, or loosely tucking in towards the thumb area. So we can do our short knuckles here. Again, I've still got hold of the wrist of the client here, so I'm supporting it and I'm able to then move that arm up and down. Okay, when I'm coming up towards the elbow joint and then releasing that pressure. As I release the pressure and come back towards the wrist, I can do two things here. I can either slide lightly back down towards the wrist, or I can then open up the hand and sort of do an effleurage back towards the wrist. So it's up, pressure on as you're coming up, and releasing that pressure as you come down. You could also follow that all the way up the arm as well towards that deltoid area. So pressure on, coming up towards the deltoid, trying to use your body weight to press into your arm as you come nearer to the deltoid region, because again, most people have got tension around that deltoid area. So if we're doing that long knuckle, pressure on, coming up towards the elbow, then again, nice lunge technique with the legs to help you to apply your body weight evenly all the way up that upper limb. And then just changing the direction of that hand, all those knuckles, to make sure that you're covering all of the tissue. Once you've spent a little bit of time on the top of the forearm here, we can then turn that forearm over. Again, often people have more tension on that wrist flexor group. So if your client has got lateral epicondylitis, you might find them more tender on that lateral side. Or if they've got medial epicondylitis, they're going to be more tender on the medial side, and you might find more tension in that wrist flexor area. But regardless of whether they've got lateral or medial epicondylitis, you're still going to treat both groups, the wrist flexors as a group and the wrist extensors, because they're opposite muscles to one another, and there will always be tension on both sides of the limb. Okay, so again with the knuckles here, making sure you're still supporting the arm, and again using those knuckles in that short sweep, either coming back as an effleurage, maintaining contact with the tissue, or coming back with those knuckles, but again, just reducing that pressure. When you're applying the pressure with the knuckles, you want the wrist straight as well. So the part of the knuckles that's touching the tissue is this here. It's not the joint here, it's this flat part here. If you're using the other flat part nearer to the fingertips, your wrist is going to be at an awkward angle, and then long term that might cause an injury to your wrist. So always be mindful of your own wrist joint when you're applying that pressure as well. And again, you can change the position of your hand as well, so that the thumb is either pointing up towards the joint or into the medial side of the client. Okay, and again, we could use knuckles coming up over the biceps as well. Quite often the biceps can be a bit tender, so it's good practice to reduce the pressure at first as you're coming over the biceps, just to see how your client is reacting to that area. Okay, we can also use our forearm here. That's quite nice, especially if you've got a larger arm to work on. So you might have powerlifter, bodybuilder, etc. So even with your smaller clients, you can also use that forearm, but just need to make sure that you're adjusting your pressure effectively. So I've still got hold of Katie's wrist here. And in this instance, what I'm going to do is, again, I can come into her wrist extensors. I can turn that arm round as I come into the wrist flexor, so a short movement but still effective for reducing that muscular tension. Okay, and I'm using my legs to help transfer my body weight, and then we can do that nice long sweep as well up the whole of that arm. So forearm, coming over that elbow and all the way up towards the shoulder. And again, I'm making sure I'm transferring that body weight between my feet. So I'm being mindful of my own body position as well. Sometimes as a therapist, especially a new therapist, we can be a bit tentative with the arms, but most people have quite a lot of tension in the arms, so it does feel nice to have that released. We can also strip to the forearm using those thumbs. Really effective techniques. So again, holding either onto the wrist, or depending on your client, you can also hold onto their hand as well to help to turn that joint round. So our radial ulnar joint, it's nice to come into pronation and supination as we're stripping here. Okay, so I'm going to take hold of Katie's wrist here, and I'm just turning at that radial ulnar joint as I'm using my thumb here to strip into her wrist flexors. I can feel she's got a lot of tension here. She's a therapist. She's got some erythema coming up there. So we're just being mindful about how much erythema is coming up and her own sensitivity levels there as well. So stripping into the wrist flexors and wrist extensors. Okay, and just changing that position with your other hand to make sure that you're hitting all of that tissue. Okay, so it's a nice grip with your hand as you're coming up, and application of pressure with that thumb as well. Okay, so that was our heavier pressures on our upper limb. Okay, so just to recap there, we are effleuraging first, and as we effleurage, we're lifting that arm so we can get that massage medium over the whole of that area. Okay, we would have then come into our petrissage techniques, helping to warm up the tissue, ready for these heavier pressures. Then we can knuckle to the wrist flexors. We can knuckle to those wrist extensors. Okay, so into our wrist extensors, into our wrist flexors as well. We can turn the position of our hand round, so it's either more broad or more narrow with that massage technique. We can knuckle all the way up the arm as well towards the deltoids and up to the top of the shoulder. And being mindful again of where we've covered the tissue. We can use our forearm into those wrist extensors and into those wrist flexors. And we can also use the forearm all the way up the arm. And then finally, we can strip into the wrist flexors and those wrist extensors as well. Where time permits, we're going to flush in between each of those techniques with our effleurage. So we're flushing back towards those lymphatic nodes. And also we can combine these heavier pressures depending on the needs of our client with our active movement techniques and our soft tissue release techniques as well. Along with the use of these heavier pressures for releasing that muscular tension and combining knuckles and the forearm, along with soft tissue release and active movement that is shown in another video, it's nice to also combine this with our trigger point technique and our friction technique, especially where we've got lots of adhered fibres around the forearms or these common trigger points at the deltoid tuberosity or into the middle of that lateral head or the anterior head. So with our trigger point technique, if again we had a client suffering from medial or lateral epicondylitis, quite often if they've got lateral epicondylitis, they might have a really adhered fibres and a tender spot roughly just below of that elbow joint or just above that elbow joint. Okay, so in this instance, if we were doing trigger point technique, we can use our thumb to hold that pressure down. So we know that trigger point technique is a manual compression or is a form of manual compression. And generally we would hold this for about a minimum of 30 seconds so that we're pushing that blood flow out of the area and providing a stretch to the tissue. Then when we release that pressure, that blood flow is going to come rushing back in, and as that blood rushes back into the area, that can trigger a relaxation effect in those muscle fibres. So we can either hold this down for 30 seconds and then release, okay, or we could hold this down for 30 seconds. Then after another 30 seconds, we're asking our client for their pain scale between 1 to 10. And if it's reduced to about a 4 or 5, we can then keep that thumb on and then for another 30 seconds and press down again slightly deeper, just to increase that number on the pain or the discomfort scale. So we're roughly aiming for about a 7-ish on that discomfort scale. So each time we apply this manual compression, we're asking for the client's comfort level on that scale of 1 to 10. Okay, so another common area that we will often find adhered fibres and trigger points is right in the belly of this wrist flexor area. So again, here we can hold it down with the thumb. We can also use our knuckle here as well to apply the pressure. So generally in the forearm area, depending on the size of your client, you would either use your thumb, but making sure there's a slight bend in the thumb to protect your own joint, okay, or you would use your knuckle, one knuckle or possibly two knuckles for a more broader area to apply that pressure. And you're either applying that pressure for 30 seconds, 60 seconds, or even up to 90 seconds, but constantly checking the client's comfort level at each stage. So initial check when the pressure goes on, then check again after 30 seconds, and so on. Our other common area for that trigger point, as we mentioned, is around that deltoid tuberosity area. So again, here we're pressing into the side of the body, so it's quite often quite nice to use either one knuckle or two knuckles here to apply that pressure. And again, you can think about where the tension is. Is it broader in this direction transversely across the fibres, or is it more broad, sort of like longitudinally going down the side of the arm? So we can adjust that position with the knuckle or the two knuckles to match what we're finding in those muscle fibres. Okay, so we can use our trigger points on their own, or we can combine our trigger point technique with a circular friction afterwards. And that works really nicely. So for here, for instance, if we've got a trigger point, we would hold it down for 30 seconds. And then after releasing from 30 seconds, we can then move that into a circular friction. So our circular friction is where we're circling those muscle fibres, or circling our thumb around those muscle fibres. We could also move in to a longitudinal friction, either with one thumb, or we could relax that arm down and we can do our longitudinal friction in this direction also. We could also move into our transverse friction, where those thumbs are coming across the tissue. Okay, so we can layer our trigger point with our friction technique, or we can do our trigger point technique on its own, or we could do our friction technique on its own as well, and then flush in between each of those techniques with our effleurage. So that was our heavier pressures to the upper limb.